How important is it to listen to those post-op activity restrictions given by your surgeon or your PA? Hi, I'm Santina. I'm a board-certified physician assistant, and today I'm going to be talking about the importance of activity restrictions that your surgical team provides for you, depending whether the surgery is reconstructive, cosmetic, any activity restrictions. And if you do not follow these activity restrictions, things that can happen and complications that can happen if we don't stick to those guidelines. So firstly, every surgeon varies. Every surgeon has their own protocol of activity restrictions, what they'll allow, how soon, how late. So it really is surgeon dependent, and I want to preface with that what I'm about to tell you is not end all be all. It really is just the importance of sticking to what your surgeons tell you to do. So the biggest risks that can happen in the first 3 weeks after surgery, you're at greatest risk for developing a hematoma. So if we're mainly focusing on breast and body surgery, so breast and let's say abdomen, the biggest risks of a hematoma are just increasing your blood pressure, increasing your heart rate over those first 3 weeks. The only thing you really should be doing for the first couple weeks after surgery is getting up and walking and moving to help circulation in your legs to prevent blood clots. So let's say you don't listen to activity restrictions, you're vacuuming, you're lifting laundry baskets, doing things that you really should not be doing. It does put you at increased risk for a hematoma, which is a big localized blood clot to the surgical area. So sometimes you may, depending if it's within the first 24, 48 hours after surgery, you may need to be taken back to the operating room to have this removed. Most times, if it's about a week or two later, you'll notice increased swelling, increased pain to the breast, and definitely increased bruising. Same thing, the belly's a little bit harder to detect, but you'll notice that something just feels off. It's not this normal post-op recovery that you've kind of been going through. And so if a hematoma develops, most times the body will just reabsorb the blood that's in that area. If it's super slow progressing. But again, sometimes you may have to go to the OR. Now, if you are weeks and weeks out of surgery and you still have those activity restrictions and you're not following them, you do put yourself at increased risk for a seroma. Now, a seroma is a big fluid collection that can happen in any surgical site, breast, belly. And so what can happen is we would either need to bring you back daily to drain the area, and then you'd provide compression, and it is an everyday thing you'd have to drain because it will reaccumulate. Sometimes these seromas can become infected, which could cause you to have to go to the emergency room for IV antibiotics, or have to go to interventional radiology and have a drain placed. So I know a lot of patients hate to have their drains in for a long period of time. Again, whether that's breast, whether that's tummy. If you have multiple drains in one body area, and you pull both at the same time, even if they are ready, it does put you at increased risk for a seroma. So as much as patients hate the drains, they do serve a super important purpose in preventing complications like a seroma. So these are the two biggest things that can happen. Obviously, risk of infection, risk of incision breakdown as well, increase in wounds. So those things can happen as well if you do not follow the activity restrictions, but I promise you those activity restrictions are there for a reason. So please listen to your surgical team. If you have any questions, drop it below. Thanks.